Hello. So for this week's journal assignment, week one, I will be answering the questions. And number one, describe your clinical experience in the mental health throughout this program so far. So far, I have enjoyed my experience very much. I started out working at an outpatient clinic that is through my current job, and they work with dual diagnosis patients who had, many of them had substance abuse issues, along with some mental health diagnoses such as bipolar and schizophrenia and others. I love that very much because the patients were very open and willing to talk about their experiences, and they were willing to be open for help. So I feel like I learned a lot from them. My last semester, I was with a psychiatric nurse practitioner. I did both virtual and in-person visits with her. Most of them were the geriatric population that I would come in for on those days because that's what that semester was based on. I also felt like I learned a lot there. In the past, I did do long-term care with the geriatric population, but it's a lot different with psych, even though a lot of what the geriatric population experience in long-term care is related to psych. A lot of those patients that I worked with in the past didn't actually have psych diagnosis. It was more like Alzheimer's or dementia. And this semester, I'm working with the same nurse practitioner, but now just pediatric. So the days that I'm with her now is with her pediatric patients, more of them. So far, I've been with her this weekend. It's been a lot, and I feel like I've learned a lot just in this little bit of time with these kids, even though I did see a lot of them last semester with her as well. I have not changed why I want to work in this area. It started when I did my RN program. I came to the hospital that I work for now for clinicals, and I fell in love with psych. Prior to that, I always said I would never do psych because I was scared of it. You know, a lot of times we're scared of the unknown. And when I did experience it for myself, I loved it. I still love psych. I don't think that that's going to change for me. The human brain is so phenomenal, and the amount of things that you learn in school along with what you're learning at work and along with what I'm learning in clinicals is just, I feel so much smarter, and I feel so much more prepared to sit and talk with patients and do a one-to-one visit in the future when I finally do finish school. Discuss any concerns regarding the specific clinical course. I don't think I have any concerns. I'm just, like I said, very open to learning. I love to learn, not just with psych, but just in general. I'm just always open to learn something new. You never know too much, you know. Identify personal and academic goals for this clinical course. I would say getting more comfortable with the pediatric population when it comes to assessing them on the NP level versus the nursing level. I've worked with, of course, the NP is a nurse, but a more skilled nurse because I worked with the pediatric population and adolescents at my current job for about 3 years, and I loved it. The kids, they loved me. I always did good with them, and upper management always wanted me to work with them because I had a good rapport with the kids and they respected me, and I didn't have, see, like a lot of behaviors didn't really happen when they worked with me. And it wasn't that I, let the kids run over top of me or do what they wanted to do, but they just have respect for me. And I think a lot of that came from them knowing and understanding that I truly cared about them and wanted the best for them. A lot of times people work with that population and they don't understand that you can't just be about a check. You have to truly want to do what you're doing because the kids are just like animals, just like a dog can sense if you're really a good person or not. And I think a lot of the kids can do that. Um, some of my personal goals, besides what I already named, I would say is to probably work with younger kids. I have worked with those who are 11 and up, but I haven't worked with many under that. So, I'm a little bit more excited to see some kids around like 7 and 8, 9, 10, and that age. Are there any specific goals as I wrap up the program? No, none in particular, just to be a better me, a smarter me, a more understanding me, and just to be ready to get out there and do the job. Because you can't, like my nurse practitioner that I'm doing my clinicals with, she says most of what she knows and most of what she's learned is from experience, regardless of what you learn in school, regardless of what grades you get on the test, until you actually get out there in the field excuse me, with these patients and learn on an individual basis about each patient and how different medications work for certain people, how certain traumas cause certain issues with certain people, then you won't actually get the experience that you need. It just has to be a more hands-on thing. So I'm just excited to get out there and do it. That is my goal as I wrap up the program, as I do this clinical, last clinical, and then the next one. So I feel like the more patient interactions that I have, the better I'll be when I am independent one day. What strengths and weaknesses? I think my strengths I've identified is my empathy. Of course, we all have sympathy at times as well, but I feel like empathy is very, very significant because a lot of people don't understand that just because you didn't go through what the person is going through, that doesn't mean that you can't show that you do understand what they feel, along with wanting to help them through the situation. So I've seen a lot in my experience of working in my current job. A lot of the psychiatrists come in and assess patients, but they just don't seem empathetic to me. And the patients notice that as soon as they leave. They're like, they don't care. He talked to me for 2 minutes and he just left. So you gotta let them know that you are trying to understand them, even if you don't. Weaknesses. Me, myself, personally, a weakness I know I do have is trauma for pediatric children who have been sexually abused, and just having to keep the strength because I experienced a family member when I was a young girl had been kidnapped when we were little kids, and I dealt with that myself with her. And even though she's grown and thriving and doing okay now, every time I see her, I see what happened to her. So I feel like when I meet young girls and young men who have been sexually abused, a lot of times I see her, and I don't like that because I know that's not something that is professional. So, I do my best to try to mask that and, to try to keep a good poker face and just let them know I'm here for you. But I don't want them to think that I'm just constantly reminded of something that I've been through, because we've all been through things in life. So that's what I would think my biggest weakness is when it comes to mental health. And that about wraps it up. Thank you.